Central sympatholytics in hypertension. Imagine you're in the emergency department. A 55-year-old man arrives with a blood pressure of 220 by 120 millimeters of mercury and a severe headache. You administer clonidine, and within a short time, his blood pressure begins to fall. A few weeks later, another patient walks into your clinic, a pregnant woman with newly diagnosed hypertension. This time, you choose Methyldopa, one of the safest antihypertensive drugs during pregnancy. Surprisingly, both of these drugs lower blood pressure by acting inside the brain, not directly on the heart or blood vessels. In this video, we'll understand the mechanism, clinical uses, and adverse effects of the central sympatholytics. The drug class at a glance. Central sympatholytics include clonidine, Methyldopa, Guanfacine, and Moxonidine. Clonidine is a rapid-acting central sympatholytic and is commonly used in hypertensive urgency because it lowers blood pressure relatively quickly. Methyldopa is the drug of choice for hypertension during pregnancy due to its long-established safety profile for both the mother and the fetus. Guanfacine is a longer-acting alpha-2 adrenergic agonist, providing more sustained suppression of sympathetic activity. Finally, Moxonidine differs slightly from the others because it acts predominantly on imidazoline receptors in the brainstem, although the final effect is still a reduction in sympathetic outflow and blood pressure. Mechanism of action. Central sympatholytics stimulate alpha-2 adrenergic receptors in the vasomotor center of the brainstem, reducing sympathetic outflow to the heart and blood vessels. From brain signal to blood pressure drop. The first step is alpha-2 receptor stimulation in the vasomotor center of the brainstem. Activation of these receptors suppresses the sympathetic nervous system, leading to decreased sympathetic outflow to the heart and blood vessels. As sympathetic activity declines, there is a reduction in heart rate, cardiac output, and systemic vascular resistance. The combined effect of these changes is a fall in blood pressure. Thus, by reducing sympathetic signals at their source, these drugs produce a broad reduction in cardiovascular tone throughout the body. Clinical uses. Their primary role is in moderate to severe hypertension, where they are used as add-on therapy when first-line antihypertensive drugs alone fail to achieve adequate blood pressure control. A particularly important indication is hypertension in pregnancy, where Methyldopa is the preferred agent because of its long-established safety for both the mother and the fetus. These drugs are also useful in resistant hypertension, when conventional therapy is insufficient. Finally, in hypertensive urgency, clonidine may be used for relatively rapid blood pressure control. Thus, central sympatholytics are reserved for specific clinical situations rather than routine treatment of hypertension. Why Methyldopa in pregnancy? Methyldopa has remained one of the safest antihypertensive agents during pregnancy for decades. Its long safety record and well-characterized fetal profile make it the first-line choice when blood pressure must be controlled without harming the developing fetus. The clonidine warning. Stopping clonidine abruptly can trigger dangerous rebound hypertension, a rapid, severe spike in blood pressure caused by a sudden surge in sympathetic activity. Never discontinue clonidine suddenly. Always taper the dose gradually. Common adverse effects. The most frequent complaint is sedation and drowsiness due to CNS depression following central alpha-2 receptor stimulation. So patients should be cautioned about driving or operating machinery. Another common adverse effect is dry mouth, which occurs because of reduced salivary secretion. Reduced sympathetic tone also slows the heart, producing bradycardia. Finally, these drugs can cause constipation by decreasing gut motility. Although these adverse effects are usually not life-threatening, they may affect patient compliance with long-term therapy. Methyldopa-specific adverse effects. Although methyldopa belongs to the group of central sympatholytics, it has several methyldopa-specific adverse effects that are not seen with the other drugs in this class. The most important is hemolytic anemia, which is Coombs positive and results from immune-mediated destruction of red blood cells. Another important adverse effect is hepatotoxicity, which may present with elevated liver enzymes and rarely significant liver injury. Methyldopa can also cause hyperprolactinemia, leading to galactorrhea or amenorrhea. A positive Coombs test is a hallmark finding. Therefore, patients receiving long-term therapy should be monitored if anemia is suspected. Key takeaways. Let's conclude with the key takeaways about central sympatholytics. First, remember their brain-based mechanism. They stimulate brainstem alpha-2 receptors, which reduces sympathetic outflow and ultimately lowers blood pressure. Second, methyldopa remains the preferred antihypertensive during pregnancy because of its long-established safety record. Third, never stop clonidine abruptly, as it can cause rebound hypertension, a serious but preventable complication. Finally, remember the methyldopa-specific adverse effects: Coombs positive hemolytic anemia, hepatotoxicity, and hyperprolactinemia.